good afternoon, everyone. So we are about to start our webinar now. Good afternoon again and welcome. Thank you for joining us for today's webinar. My name is Marcia de Ocampo, and I am from iCube Group of Companies. Today, we are presenting the DTI-DOLE guidelines on workplace prevention and control of COVID-19. To keep the webinar and program organized, we would like to do a little housekeeping before we get started. So first, please ensure to mute your microphones while the presentation is ongoing. This is to avoid unnecessary noises and ensure that everyone hears the presentation clearly. Second, for privacy purposes, should you wish to be anonymous, participants are recommended to rename your profile by clicking on the ellipsis button at the top right corner of your profile. Then, clicking the rename button and changing your alias. Third, to avoid distractions, we have turned off the video of the participants. For a better view of the presentation, we would like to request everyone to right-click other participants' profile and choose the hide non-video participants. Fourth, we will have time for questions at the end of the presentation. If you have any questions during the presentation, please type them into the chat box by clicking the chat button at the lower part of your Zoom screen. I'll bring the question up later after the presentation. You may also type in Japanese and someone will be translating it for us. Okay. Should you wish to personally raise your own question, you may choose to click on the participant button at the bottom of your Zoom screen. A white participants panel will appear at the side of your screen. You may click on the ellipsis at the right lower portion of the panel and choose Raise Hand. If you wish to be seen while raising your questions, we will be turning on your video at your option. Finally, recording of this webinar will need certain approval from the host. Should you need a handout or a copy of the presentation, please email us at icube.japandesk@link.isha or at shimizu@link.isha. To give you the opening remarks, I am turning the screen to Ms. Geraldine Sakamoto's message. So while waiting for the video to play, okay.
Greetings. Thank you for attending iCube Inc. HR Kenshu Series 2020 webinar. My name is Jerry Baton, President of iCube Inc. At May 8th, we have conducted a webinar in Japanese on the topic of mitigating COVID-19 risks and business continuity planning in the Philippines. Today, we would like to discuss the DTI-DOLE guidelines on workplace prevention and control of COVID-19. Currently, we are experiencing a one-in-a-lifetime public health emergency situation in the Philippines. COVID-19 has not only devastated the Philippine economy, but upended so many Filipino lives since it entered at January 2020. There has been several quarantine implementations and guidelines that was laid down not only by the national government, but by the LGUs to control the spread of the virus and ensure that commerce, particularly for the basic needs, would reach to the people. But with so many information and guidelines, it's sad to say that it had just contributed to the confusion and panic. Several businesses that are not in line in the manufacturing of the basic needs or distribution of it are ordered temporarily to shut down as part of the government's preventive measure. But now we are nearing the second month of the quarantine, and the direction of the government is to lifting these quarantine measures. But there has been a lot of concern raised by employees, businesses, and public figures. And due to this onslaught of ongoing chaos of information, and a lot of information that comes from internet, which may be reliable or may be reliable. The thing is that we find that we have the responsibility to provide reliable information. So we have decided to conduct this webinar to enlighten our clients about the implementation of the new normal guidelines through this webinar. And we hope to explain COVID-19 preventive measures to allow companies to consistently operate safely and in accordance with the government regulations and directives. iCube stands for 3 I's: information, incubation, and investment. We hope through this webinar and upcoming webinar, we are able to provide you relevant information for your business to help manage your business so that your business could navigate through this public health emergency situation in the Philippines. Thank you very much. And I'll hand the floor to our MC and speaker. Thank you.
Okay, so that was an informative opening remarks from iCube's president, Ms. Geraldine Sakamoto. Okay, so now to discuss to you the objectives of the program, I am turning over the screen to Ms. Marilyn and Galiano Todero. Ms. Marilyn.
Hello, good afternoon to all participants, and we would like to welcome you in today's HR Kenshu training, which is a regular seminar offering of iCube Group to its clients. It aims to impart knowledge and understanding about the current labor relations and human resources trends in the country, to put into context the consultancy services it offers, and allow the companies to consistently operate compliant with the laws. As we are in the modified enhanced community quarantine, where mass gathering is still prohibited, iCube Group is launching its first webinar, making the seminar digitally available to all our clients. This is a free webinar, but we certainly guarantee you that you will learn and obtain timely and relevant information on the DTI-DOLE guidelines on workplace prevention and control of COVID-19. Understanding the condition of these guidelines are necessary as they will have impacts on the operation of many private companies in the country. At the end of the discussion, you will learn a lot of things and gain significant insights on what the guidelines minimum set by DTI and DOLE to assist private institutions that are allowed to operate during the modified enhanced community quarantine and general community quarantine. And finally, to develop the minimum health protocols and standards in light of the COVID-19 pandemic. In this crisis due to COVID-19, extraordinary and uncertain time calls for unusual actions, especially in the domain of our workplaces to prevent and control COVID-19. On that note, in case of technical difficulties at any point of the webinar, please bear with us. My name again is Marilyn Angeliano Todero, and I am part of the good-looking and innovative HR team of iCube Group. I will turn over now the video to our host, moderator, Ms. Marcia. Take it away.
Thank you, Miss Marilyn. I also believe I'm from iCube Group of Companies. I'm beautiful too. I hope you all agree. Okay, so thank you again, Miss Marilyn, for the blissful opening remarks. Objective of the program, for giving us the objective of the program. Okay, so to proceed with our program, I am glad to introduce to you our presenter for today. He is a human resource practitioner for more than 20 years now, specializing in legal research and labor law, and is a member of the National Tripartite Industrial Peace Council and elected council member of the National Anti-Poverty Commission under the Office of the President and assigned as private sector representative and elected chairperson of the Development Administration Committee of the Regional Development Council 4B. Now, without further ado, we will turn the time over to our presenter, Mr. Darius Guerrero.
Thank you, Ms. Marcia, for that humbling introduction. Good afternoon, everyone. I hope you're all continuously being mindful of your safety, and I also hope I'm part of the description as to beautiful member of the iCube group. Anyway, what I will be discussing in this webinar is not only our topic, which is the DTI-DOLE interim guidelines on workplace prevention and control of COVID-19, but also I will provide a brief discussion on the current controversial Labor Advisory number 17 by the Department of Labor and Employment, and some highlights on the Department Memorandum by the Department of Health on return to work. In this perspective, let us take a brief view of what's happening in our country. Can you go back a bit? Okay. So there has been an order already to start business operations under different quarantine levels. There are different categories, of course. Some industries have been categorized as to category 1 to 4. And the application as to whether companies can already report for work or can start their operations depend on the quarantine level, whether it's ECQ, MECQ, GCQ, and sometime early in May, the modified GCQ, General Community Quarantine, was also introduced, though it was later on withdrawn by the government. But the operations of business are either full operations or skeleton operations, or 50% of the manpower. In this situation that companies are now operating, companies are into at least two major situations. One, many of the companies are looking into how do we maintain continuity of our business. As such businesses, if you have read in the news, for example, the Department of Labor and Employment has already announced that 50 micro, small, medium enterprises have already applied for closure of their companies. It affects about 190,000 workers. So many of the companies will really have to think of how they could continue their business, noting that 96% of the establishments in the country are actually micro, small, and medium enterprises. And if you don't have problems with continuing your operation, the next thing that you will have to consider is how do you comply with the new normal. The situation, there are several guidelines that are provided for companies to ensure compliance with the new normal and prevent further infection by the COVID-19 disease. So when we talk of COVID-19 and the business continuity, we have to look at, for example, Labor Advisory number 17. Labor Advisory number 17 is actually premised on companies coming back to work, companies starting their operations already. So Labor Advisory number 17 applies to all employers and their employees, regardless of the employment status of the employees. It also applies to the private sector and for companies already allowed to resume business operations. We take note that I think parlors and barbershops have not been allowed to open yet because of the problems in distancing. But the labor advisory highlights that if companies operate, there has got to be minimum health standards that have got to be followed by these companies. Among the minimum health standards are provided in the DTI-DOLE interim guidelines on workplace prevention control of COVID-19, which was released in April 30, 2020. And for the construction industry, particularly the build bid projects of government, the DPWH has released the Department Order number 35. And again, on May 11, 2020, the DOH, Department of Health, has issued Department Memorandum number 2020-0220, which provides certain interim guidelines on the return to work. While internally, this is with the hospital and healthcare networks, some portions of such department memorandum by the DOH are also applicable to many companies. So again, the labor advisory has reiterated in several labor advisories, even during the Taal volcano eruption, the government has already said that work from home is encouraged. And Department Order number 202 of 2019 provides for certain guidelines for implementing work from home or telecommuting work arrangement. The next provision on the labor advisory, section 4, provides for the alternative work arrangements. The alternative work arrangement or alternative work schemes says if the company is really having problems with its finances, it can actually transfer employees from one branch to another branch or another outlet, for as long as the employee works at the same employer. Or the employee may be assigned from one position to another position. For example, because you don't have waiters in a restaurant, because most of the orders are takeout, you can assign your waitress to do cashier job so that you don't have to terminate people. Another way for companies may also adopt is the reduction of normal working hours. So if, for example, you have 6 days work in a week, you can reduce it to 5 days, or 5 days work in a week, you can actually reduce it to 4 days. This particular scheme is now currently being debated in the Congress. They call it the compressed work week. This has been in existence even before, and companies will have to apply. But if it is passed into law, then it is a regular option by companies to implement. Also, another alternative work scheme is to implement job rotation. Alternately, for example, if you have an operation that is for 6 days a week, and you have John and Peter doing work, both of them doing work for 6 days, you can actually assign John to do the first 3 days, and the next 3 days will be done by Peter. This is what we call job rotation. Or unfortunately, and we don't want to promote this, but if really very necessary, the companies can actually partially close certain parts of the establishments or certain departments or section, or just to ensure that the company continues its operation. Other feasible work arrangements have been provided in previous labor advisories. For example, forced leave has been advised and given as an option before. Also, continuously temporary closure of the establishments. What's controversial about this labor advisory is Section 5. Let me refer you to the next slide. Section 5, wages and wage-related benefits. Employers may agree voluntarily to reduce, for as long as it's in writing, to adjust. It's saying it's adjust, but it can be reduced the employee's wage or benefits, wage-related benefits that are provided in the company policies or the collective bargaining agreement or in the specific employment contract. You can do this for the next 6 months And after the expiration of the 6 months, you can actually or renew or change, negotiate again the next terms and conditions of the employment that has been negotiated between the employer and the employee. This is controversial somehow because many labor organizations are contesting this particularly labor advisory by the Department of Labor and Employment, saying that this is against the law. They refer to Article 100 of the Labor Code of the Philippines, which says that you cannot reduce or take away, diminish or take away existing wage or wage-related benefits by the workers. Of course, there are certain jurisprudences that the Department of Labor has referred to in issuing this particular provision of the Labor Advisory number 17. Next, part of the Labor Advisory is the previous issuance, Labor Advisory number 6 of 2020, which says that in cases of authorized causes of termination, then the company may implement separation and payment of separation pay and final pay within 1 month after terminating the employee and providing for certificates of employment. But of course, in whatever you do, you'll have to report to the regional office of the Department of Labor. For those who are adopting the alternative working scheme, you'll have to report to the Department of Labor, including the accomplishment of establishment termination report. You may also use the Bureau of Working Conditions per Skype form. So that's a brief glimpse of Labor Advisory number 17. It's important for us to take note that the Labor Advisory was actually merely a compilation of several labor advisories before, or department orders or laws, but particularly they issued it noting that its importance in the current starting of operation of many of the businesses. Now, going to the main topic of our webinar, let me discuss the DTI-DOLE interim guidelines on workplace prevention and control of COVID-19. I'm using the official slide presentation of the Bureau of Working Condition for this. However, I'm adding some highlights of the Department Order of Department Memorandum of the Department of Health on interim guidelines on the return to work. I think it's important in as far as, of course, the IITF lead agency is the Department of Health. So the objectives and coverage of the DTI-DOLE guidelines is to assist private institutions who are already allowed to operate during this ECQ or MECQ and GCQ, and ensuring that these institutions abide by the protocols and standards in the light of the COVID-19. It applies to all workplaces, all employers and workers in the private sector. The government agencies have their own regulations as are issued by the CSC, the Civil Service Commission. And this is also aligned with the Department of Health Administrative Order 0015 series of 2020 on the risk-based public health standards for COVID-19 mitigation issued in April 27, 2020. As I said, part of my presentation, I'll be discussing the Department of Health, Department Memorandum, which is basically primarily addressed to its network of hospitals and healthcare facilities. But this is worth noting because they even advise it to be implemented to private sector. So what are the general guidelines in the DOH Department Memorandum? 1, employers in the workplace shall adopt business continuity plan to prevent the spread of COVID-19. So that means work arrangement will have to be made such that there is a reduction of work or people in a certain workspace. Secondly, if there's a need to travel, it should be reduced, including public transportation from the worker's home to the company. So if things can be done at home, work from home situation, the general guideline provides that it is encouraged. And particularly if it applies to 60 years of age or people yung under the second citizenship, the senior citizen, and those with comorbidities or other illnesses or pre-existing illnesses such as hypertension, diabetes, cancer, or any other immunocompromised health status, or with high risk of pregnancy. So these are people who are encouraged to work away from the company, work from home. So I think also it's important for us to look at the general guidelines by the DOH, particularly because it says that there has got to be social support to facilitate compliance, among which support includes we may have to review our policies on sick leave. For example, many of our sick leave requires medical certificate, for example, for 3 days absence. Medical certificate will require you to go to the hospital or clinic at least to be checked by the doctor. There are certain things that are now changing in the hospital and healthcare industry, wherein many of them are actually promoting an online outpatient scheduling appointment with the doctor. And they're limiting their patients to about 8 to 10 people per day. And every time that they are having their checkup with a particular patient, they will have to change their PPEs and then disinfect the clinic for every patient. And if that happens, how can you have a medical certificate? When in fact, the DOH guidelines provide that if you feel sick, you just stay at home and be in quarantine for a certain period of time. So we'll have to review this, not only our policies on our sick leave, we also have to review our medical insurance coverage. The current industry practice in hospital industry, and it's continuously changing. For example, if you are paying 500 peso consultation fee, you will have to pay 1,000 at the minimum. And if you are charging it to your card, the doctor will most probably say you'll have to shell out money to cover for the other expenses, which will not be covered by your card. So we'll have to review our medical insurance coverage to accommodate to COVID-19 situation. PhilHealth has limitation. Our health HMOs have limitation. So I don't know how expensive, but I've heard it's about $1 million if you want to recover from a COVID-19 disease. And we'll have to review this if we are to take care of our employees, because one person getting infected by COVID-19 would be a lot of risk for the whole company. We also have to review on our allowances. I don't know if particularly on several companies, what allowances you have, but we'll have to review this in the light of these changing policies that would allow our workers to cover the costs or the risks provided by COVID-19. Workplace facilities shall screen returning workers. There will be temperature checks. There will be proper disinfection. I'll go to the details of that when I go further to the DTI-DOLE guidelines. So the Department of Health actually proposes non-pharmaceutical interventions at the workplace. So they are proposing infection prevention control measures, hygiene promotion, environmental cleaning, regular disinfection, physical distancing, and we have to continuously inform our workers about the need to take care of their health, not only in response to being affected or infected by COVID-19 already, but as preventive measures and other public health and safety measures. Now to get into the details, first, the DTI-DOLE guidelines is saying it's part of the guidelines by both the agencies they're saying that there has got to be increased emphasis on being healthy, staying healthy. We eat nutritional foods, well-cooked foods, plenty of fluids. We have to have adequate rest and at least 8 hours of sleep. I don't know, for many of you, I'm having problem with the 8 hours of sleep, probably because of old age. And to exercise regularly. Companies are not required, but they are enjoined to um, provide for free medicines and vitamins to their employees, because that will strengthen their health and their uh, resilience to the virus. And we may need to provide for referral for workers needing counseling. One of the results of the quarantines implemented by the government is that many people are actually having mental problems, not really disorders for some, but mental health issues, which we did not expect before. And if you have one person, for example, joining you back in your company when you start operating and you didn't know that he has been affected mentally already by the quarantine, you need quickly a, a system, a scheme for referring them to uh, mental health providers. We have to reduce transmission of the COVID-19. It has got to be not only inside the workplace, but even before they would be able to enter your manufacturing gates or the buildings where your company is located. So it would mean that no mask, no entry. At all times, the employee should be able to wear their mask. Their temperature should be checked and recorded. Disinfectant alcohols and gels should be provided. The provision of foot baths is encouraged, if practicable, at the start, the entrance of the building. And let me take note of the accomplishment of the daily health symptoms questionnaire. The questionnaire is required by the DTI-DOLE guidelines. This has got to be submitted and shared with the Department of Health. So the health symptoms questionnaire has got to be accomplished. But of course, if people will line up at the gate, they'll temperature check, and they still have to accomplish the health symptoms questionnaire, then that may take a long line. It will take a lot of time for them to get inside the building. So the HR practitioners, the HR admin or manager in the company may devise schemes in order to prevent that, the long lines. But what's important is that you have allowed your employees to accomplish the health symptoms questionnaire. So also your vehicles, you're preventing your employees from bringing in virus inside the company, but you also have to take note of your equipment or your vehicles in entering your building. So you'll have to disinfect them and make sure, again and again, this is being reminded by several people, by several agencies, 1 meter distancing has got to be maintained before entering the office. So to reduce transmission inside the workplace, some of the things that are being recommended by the DTI-DOLE guidelines is to clean and disinfect at least once every 2 hours all work areas and also those objects or equipment that are frequently being used by people. Make sure that you have sufficient clean water and soap in all washrooms and toilets. So encourage them to wash their hands frequently and avoid touching their face. Provide sanitizers, alcohol in all areas, public areas. Also the elevators, the stairways, those which are commonly being used by the employees. Next. So another way to reduce the transmission of COVID-19 inside the workplace is we'll have to rethink how our companies are set up. I know it's a bit difficult because, for example, in one machine in a manufacturing company, 2 or 3 people are working on that machine. I know it's a bit difficult, but we have to make sure that there's at least a meter radius space between people. So it's a difficult task for most of the operations people and the HR, making sure that our setup in a workspace allows for a meter radius space between people. We have canteens. Normally, we eat all together at the canteen. We have people sitting with people to maintain at least, if you had to eat in the canteen, a meter distance between people. Why? Even if you're wearing the face mask inside the company, when you eat, you have to take it off. You cannot eat with your face mask on. So droplets may come out of your mouth when it has got to be done because you don't have space for eating, or you're not allowed to eat on your workspace. If you're allowed, then that's better. But if you're not allowed to eat on your workspace, then we'll have to maintain physical distancing, make sure that you dispose your waste properly, and better not to use a common utensil. If you can bring your own spoons and fork, or have your own baon, in fact, when you go to the company and eat, that's probably better. So clean and disinfect regularly canteens and kitchen. And we have to minimize contact rate. So that's why several labor advisories are actually promoting that alternative work arrangement, as I've mentioned earlier, shift work or staggered work hours or work from home. We also discourage, the DTI-DOLE discourage the prolonged face-to-face interaction. We're used to meeting people. We're very social beings that we would want to see the person that we're meeting to and be able to analyze, somehow interpret the facial emotions. But this now is discouraged because we have to maintain certain distance. Masks should be worn during meetings. It should be of short duration, and as much as possible, just like what we're doing now, is to use video conferencing instead of face-to-face meeting. It's a long, it's basically a new thing. It's part of the new normal in whatever you do now, to use digital telecommunications gadgets and systems to be able to link up with other people. So part of minimizing contact rate would be to rearrange your office tables and maintain your distancing. Design your workstation such that as much as possible, people are in directional movement in aisles, corridors, or walkways. We don't want to encourage them to actually have physical contact whenever they move from one place to another within the company. If you're using the elevator, for example, this is very dangerous because we have maximum capacity of an elevator. For example, it allows for 10 to 15 people, one elevator. It's a no-no now because an elevator is an enclosed space, and such a distance will have to be maintained, and people will have to be very careful with that. Probably half or even half of the capacity will have to be ensured in taking the elevator. Next would be another way to minimize contact rate. Also part of the promotion of our improvement of our health would be to use the stairs. That is, of course, if you are about 1 to 3 floors from the ground floor, your office is from that distance. It's a bit difficult for us, for example, if it's 7 floors. Uh, we also encourage highly online system of clients needing assistance, just like what we do. We are client based as a company, and we would always provide for assistance to clients. However, we do it, and we normally do it face to face. Now, it's a bit difficult. There are some clients who are planning to, for example, reduce their employees, and we need to convince their employees about it or tell them how to do it. But if you're doing video conferencing, this will be a bit difficult, but we have to uh, comply with such new norms, new normal, and do as much as possible what can be done. So how do you implement minimizing contact rate? You'll have to strengthen your safety and health committee. Your HR cannot do everything. So your safety and health committee may have to go around your company and check, are people complying with the physical distancing protocol and health standards about the wearing of the mask and disinfecting as frequently as possible. So next would be how do we reduce risk infection? If you have an employee who is a suspected COVID-19 patient or has been infected by COVID-19, what should you do? Of course, for example, entering the building or entering the gate, he's part of the line before he could enter. So you should be able to check, temperature check as one of the things that you will do. And if you find someone who might be or who may be, particularly if he has been in contact with COVID-19 positive patients, you can see that in the form. That's the purpose of the health symptoms form. And you have to have an isolation area in your company. This isolation area should be well built, ventilated enough, and you put the employee in that isolation area. Do not make him remove his mask. Okay, and those people from the clinic, for example, or from the HR who are attending to the workers should wear appropriately the PPEs. In this case, it may not be enough for the clinic personnel or even the HR personnel just to wear the mask. You may need the gloves, you may need certain hazmat, they call it hazmat suit, to ensure that you are not infected by the worker entering your company who is suspected of COVID-19. Then you have to contact the DOH immediately or the nearest hospital and provide transport for that particular person to be brought immediately to the hospital. The PCR testing will be done with if you bring the worker to the hospital, the PCR testing will be done by the hospital, and such report will be given to the Department of Health. And what do you do with other people who have been in line with a suspected COVID-19 infected worker? One, you have to decontaminate the workplace. It shall be decontaminated with appropriate disinfectants, and you do not allow people to work in that particular area where you have the worker working in that area is suspected of COVID-19. So at least allow a 24-hour effect of the decontamination before people are allowed there. But the workers who have been in association with or who have been working with the COVID-19 suspect will have to be undergoing the 14-day quarantine. And during the the quarantine, they'll have to do all the quarantine measures that are and protocols that are provided by several government agencies. So what if you have a worker who's sick, but fever, having fever, for example, or cough or colds, but which are not COVID-19? The recommendation of the DTI-DOLE guidelines is that as much as possible, don't let sick people go to the company. Let them stay at home so that they will be able to keep away from the crowd, so that they will be able not to infect or weaken the immune system of those still working in the company. Those staying at home, they'll have to take plenty of fluids and plenty of rest. And as much as possible, regularly practice personal hygiene so that they can prevent the spread of the disease. Next would be uh, if certain symptoms of sickness will have to persist, then the worker may have to consult with for medical care with health professionals. There are several systems now other than what I said about appointments. Fortunately, even the hospital industry are now changing. There are more ways to consult a doctor. You can even do it online. And it's not new, it's being done even prior to the COVID-19. Particularly if you have fever, if you have difficulty in breathing, or you feel certain weaknesses. Okay. So what are the duties of the employers? We'll have to promote information to always be cascaded to your workers. There are a lot of fake news. There are a lot of misinformation if you use the social media. If you look at what are being said by other people, by your friends or your networks. But it's important that they are given adequate, right information coming from the company. So certain advocacy IAC programs will have to be done by the employers. We'll have to provide for PPEs, soaps, disinfectants, and other health and safety related gadgets and supplies to ensure that you have a safe workplace. Note that Department Order 198 requires companies to provide such PPEs and other health and safety gadgets and equipment without need for workers to pay for them. So as I said, let us also strengthen our safety and health committee. Our safety officers should be able to monitor the whole of the company. The DO 198 provides for a certain number of safety officers to monitor the people. So let us do that. We'll have to comply with that particular department order. If we were thinking before that it's just for fire emergencies or earthquake emergencies, now we have a different role and a more active role for the Safety and Health Committee and the safety officers. Next. Then we have to look at, as I said earlier, we may need to enhance our health insurance provision for our workers. It's required that we provide shuttle services or decent accommodation for near-site locations so that people will not have to travel every day. Note, this new normal, until we find a vaccine for the COVID-19, even if the modified ECQ for some areas will be lifted by the end of May, we will still continue to implement these things, including probably the provision of a shuttle, because the risk of the COVID-19 will continue until and after a vaccine has been developed and has been implemented or has been given to most of the people. As such, if you would need people, the DTI-DOLE guidelines, in accordance with several department orders already before, to hire people from the local community. because that will reduce the expenses of the company. They just need to walk to and from their homes. And that's one thing we can do if we would need additional people to work in our operations. We need a COVID-19 hotline. It may not be an official hotline as we have in government agencies or call centers, but our HR or some of the Safety and Health Committee, for example, members should be able to respond, inform people as to the needed information relating to COVID-19 anytime and wherever the workers are. So the DTI-DOLE guidelines is promoting having that. The workers will have to comply with all the measures in place or those that which are being implemented by the company. Also certain etiquette, sneezing, coughing, disposal of tissues. Sometimes we don't care about this. Sometimes we sneeze using a tissue and we just put it somewhere. We just throw it somewhere. Now we'll have to be more careful doing this. So the workers will have to practice etiquette on proper respiratory care. Next. So what are the other duties of the workers? Let's look at them when we get to the next slide. Okay, COVID-19 testing. No, that's it basically for the workers. They have to comply. But is it required? Workers who are going back to work as businesses start their operation, is it required? The DTI-DOLE guidelines does not say so. The Department of Health does not say so. It's not required, but of course, it's something of a sort of security for the workers knowing, oh, none of my co-workers are actually COVID-19 positive. Why is it not required? Because of certain, there are a lot of types of testing for COVID-19. Their levels of efficiency are different depending on the tests done. And also, because if you take the test now, for example, today is May 27, you're basically you just want to know if there are people who are COVID-19 positive entering your company from their 14 days prior to them entering the company. But tomorrow they'll enter again. The next day they'll enter again. They'll probably go to the supermarket after work. They'll probably go to the wet market after work. And they may have the symptoms of the COVID-19 even after they have tested negative of COVID-19 upon testing. So there has got to be several measures that have got to be done by the company to ensure that they are continuously negative, and among which is the temperature check, as was said in the guidelines. Also, probably some companies are using oximeter, for example. It measures your oxygen level in your system, and if you are negative, then the oximeter would basically says that you're normal. That's also one way of testing the regularity of the maintaining that you are negative with COVID-19. Okay, we have to take note that there are vulnerable people, not only the above 60 years of age, but there are people who are even young. I've seen people who are having dialysis treatment regularly, weekly, even if they're just 30 years old. There are hypertensive people, even if they're just very young. So let's look at the levels of risk of our employees, not only the 60 years old people and above. These things we'll have to monitor, we'll have to check and see if they can continuously report for work, because even if they feel they can, they might
infect other people. And that's the risk we don't want to have in our company. So work arrangement will have to be done to ensure that we are not affected by the people who have other pre-existing illnesses or who are have comorbidities or immunocompromised. Next would be, okay, so what are the assistance by the DTI and DOLE? They will provide technical assistance. Other than that, they'll provide technical assistance. But we'll have to report. You'll have to do the reporting to the regional office. And we also have to report illnesses and diseases and injuries utilizing the Bureau of Working Conditions, WAIR, or the Work Accident in Illness Report form. We're doing this regularly even before, but we'll have to do this more frequently now. So this is a sample protocol for screening employees. As you can see, there will be temperature check. At the minimum, there should be temperature check. So if the employee has 37.6 or greater, 37.6 degrees Celsius of temperature or greater, he should not be allowed to enter the company premises or the building. If he has 37.5 degrees Celsius temperature, probably it's just because of the heat or the hot season. I don't know if it's still summer now, but he may be allowed to rest for a while before another check will be given to him. And if still lower than 37.5 degrees, then he may be allowed to enter. But if you have 37.4 degrees Celsius temperature, then yes, you can enter the building for as long as you accomplish as much as possible. They're saying here it's visitors checklist, but this is what we're saying, the health symptoms checklist as recommended by the DTI-DOLE. And this is the health checklist. This is a sample. So of course the HR can further improve on this, but it says, are you experiencing certain symptoms, sore throat, body pains, headaches? So we always have this when we're stressed. Fever for the last few days. That's something that we have to be looking up to. And it also has certain questions on, have you worked or stayed with the same environment with a COVID-19 positive person, or have in contact with someone who has fever, cough, cold, or traveled outside of the Philippines, or in areas outside of the NCR. So as I said, this health checklist will have to be accomplished every day. So to prevent long queues of our workers, our HR will have to find out ways in order to, at the same time that employees are working on this checklist, it does not take up so much of their time. So that's basically the DTI-DOLE guidelines and some points on the DOH Department Memorandum, as well as the Labor Advisory number 17. I hope you got them all. I hope I was not too fast. Thank you very much.
Thank you. Thank you very much, Mr. Guerrero, for the very insightful presentation. Okay, so we will go ahead and take some time for questions now. And just a reminder to our participants, please be sure to type in your questions to the chat box found at the bottom of your Zoom screens. Okay. So now I think we have received, we already received participants. We will try to answer all if time permits. But for those questions that will not be mentioned or raised here, we will ensure to send the response to your emails. Okay, Sir Darius?
Yes, I'm okay with that.
So,
yes.
Yeah. So for the first question, So
I think
is
it's a
there
difficult
any
question
support?
because you're finding difficulty in actually reading the question. Okay.
So for the first question, is there any support by the government to introduce flexible work arrangement?
Support by the government. The government allows it. It's a regulatory function of the government. But in terms of support, there are certain laws that allows for as guide for companies to implement it. What the government would want to do is simply to, if you think you will want to implement such schemes, you'll have to report that to government. Technical support they can provide, technical assistance they can provide. If you ask them about legality of one thing, it will take some time. But they're technical people. If you want it from the legal department, they're technical people can share their opinion. But of course, if you want valid legal opinions from the Department of Labor itself or from the government agencies, it will take some time for them to be able to release such. But for as long as you comply with, for example, labor advisories or department orders, then you're good with it. You can implement whatever arrangement that you would want to be implemented in your company.
Okay. Thank you, Sir Darius. So for the second question, um, regarding the flexible work arrangement, is it mandatory to introduce flexible work arrangement?
Actually, it's not. It depends on your assessment on how you can continue your business. It's about business continuity. As I said earlier, there are many companies now are looking into this situation. One, how can they continue their business? Particularly for medium, small, and medium enterprises, many of them have lost income during the period of more than 2 months of quarantine. So they don't know how to continue maintaining your payroll at the very least. You have a payroll that you have to maintain and you don't know if your cash flow is enough. So the next thing is to comply with the new normal, those guidelines which the government agencies have released, and you have to comply with them. Otherwise, you'll be penalized again. So they are not required if they think based on their assessment they don't need to implement flexible work arrangements. But based on their assessment also, if there are people who are vulnerable, then they have to think something about these people so that we would reduce the cases of infection or contact rates, contacts with those who are suspected of COVID-19.
Okay. For the third question, okay, this is regarding retrenchment. So was there any act already approved for retrenchment?
Uh, can you say that again? Was there any?
Was there any act already
Ah,
approved about retrenchment?
retrenchment, redundancy, even closure of companies are provided for in the Labor Code of the Philippines. So companies can implement them for as long as you follow procedures. For example, among the procedures is to notify the workers 30 days prior to the effectivity and the Department of Labor of prior to the effectivity of the retrenchment or the redundancy or of the closure of the company. And also, there has got to be sufficient basis, substantial basis to implement such. For example, if you are implementing redundancy, you'll have to prove to the Department of Labor that these positions or these workers are actually in excess of what is required by your operations. If you are implementing retrenchment, it has got to be being implemented to reduce further losses. So that means you are already losing somehow and you want to prevent further losses. So that's why you are separating people. It's not about separating people because you are assuming that you'll have losses in the future. So it should be something that is already actually inexistent. Closure, if you're doing the closure, then you'll have to prove that your financial state will really not allow you to continue operating your business.
Okay. So for the fifth question, Should the company do health check of COVID-19 to all employees?
Do health check.
Yes.
Health check, you'll have to do that. Okay, regularly as much as possible. You'll have to monitor the health of your people. At the very least, the temperature check. Oximeter would also be helpful, but not testing. If you start with testing that is not required, but even if you do so, you'll have to do it not only once. For example, you have first testing on the first day of your startup operation. Then, upon regular checking, you have someone who has high temperature and etc. Then you may have to, again, check at least those people who have symptoms of the sickness. Or, depending on the company, of course, if the company would want to do COVID-19 testing in every 14 days, then the company can do that. But that's very expensive.
Okay. For the sixth question, is there any support by the government to introduce flexible work arrangement?
The government can help. Technically, they can give advice as you how you can implement the flexible work arrangement and what possible flexible work arrangement that you would do inside the company. But of course, the government will always try to persuade you to ensure full employment of your workers. So they would always try to persuade you to not get into flexible work arrangements, or if you really need to do that, that's an alternative rather than doing the closure. They'll provide you with certain advices and probably some technical support. Mostly those people who are well versed with this from the regional office wherein your company is located.
Okay. For the seventh question, if the company arrange accommodation for employees near the office, is there any regulation on social distancing in the accommodation?
Yeah, social distancing will have to be implemented in all walks of life, in all levels of whatever you do. It has got to be implemented inside the company, in the houses. Of course, you cannot monitor in the families if they're doing the social distancing inside the homes, because it will be depending on the mother and the father how they would manage their children. But in the company, if you are providing for certain accommodation, it will always be part of the regulations to maintain social or physical distancing. For example, you cannot provide a room wherein there are 5 people for a room capacity for 2. So you'll be violating the social distancing policy standards, and also it defeats the purpose. The purpose of having an accommodation near your company is so that you reduce the risk of COVID-19 infection. But if you violate that in the accommodation that you provide, then there is the risk of COVID-19 infection. So yes, social distancing will have to be implemented wherever and whenever. Thank you.
So for question number 8, if employee found to be infected by COVID-19, only report to DOLE is required?
No. If you find employees who are COVID-19 suspected or probable or positive will come after the testing, you'll have to report that to the local health network, the hospital, and the Department of Health itself. The DOH has a hotline wherein you'll have to report your employee who is suspected of COVID-19. Because if you do the reporting, you will have all the government support in as much as possible to prevent its further spread or to cure or allow the employee to recuperate. So I think it's advisable also to report not only to the Department of Labor, because the Department of Labor is just for monitoring. for allowing recuperation from the sickness, it should be with the assistance of the health networks of the Department of Health.
Okay. For the ninth question, is it okay to issue the last pay of resigned staff after we resume office operations, irregardless of the date of the clearance of staff? There might be a chance that we could not comply with the grace period of 1 month since we are working from home.
Can you repeat that again? You have
The
broken
question is it okay to issue the last pay of resigned staff after we resume office operations, irregardless of the date of the clearance of the staff?
as I mentioned earlier, the what's that, labor advisory or the department order regarding the final pay has got to be done within 1 month after separation. But of course, it was issued prior to the community quarantines. And in as much as possible, if it can be done that you pay within the period as provided by the Department of Labor and DTI guidelines, then yes, we'll have to comply with the 1 month. But there is certain leniency considering the community quarantines. And yeah, I don't know if I was able to point that out, if I was able to respond more clearly on the question. So the 1 month is provided for by law. Can you do it while you're on work from home? It's understandable somehow that there has to be signed by the superiors. You'll need the accounting to put it in the system of the company in terms of accounting monitoring and ensuring they comply with accounting guidelines. So it's really possible that there's certain leniency for as long as you make your employee understand such situation, such circumstances. But in as much as possible, we try to comply with what is provided. That final pays and separation pays, if applicable, should be given within 1 month after the separation of the employee.
Okay. We actually still have 5 more questions, but we only have 10 minutes to answer all those here.
I'll try to talk fast so that I'll be able to answer all the 5.
Okay.
Anyway,
So
I'm
shall
okay.
we proceed? Okay.
I'm
So for
okay.
this
Yeah.
question, do you have any idea if those experiencing compromised mental conditions are also considered high risk to COVID-19?
I think not only COVID-19, it will depend on the assessment of the sickness of the people. It might not be just relating to his or her mental health, but it may have certain relation to certain body functioning. Note that health issues are not only psychological. Sometimes they're also biological in nature. So we'll have to allow the doctor. You know, if you have health issues, you are given certain vitamins or certain chemicals so that you relax your mind. So that means it's also biological. It's not only psychological. So there must be some relation, but I'm not a doctor, so I would I would request you to consult the doctor in relation to that.
Okay. Next question. Regarding the medical certificates, if medical certificates are not issued, what if the employee will apply for SSS reimbursement claim? The medical certificate is a requirement for the claim.
Yeah, actually, medical certificates are issued. Doctors now can issue medical certificates or even prescriptions online. So they can do that. It's being accepted by drugstores. So I'm sure even SSS, but even SSS is now trying to change their policies. They're trying to adjust in terms of allowing such situation much digitalized. Because before you have to submit everything, original copies to the SSS. Now they're discussing about it. They're trying to also change their new normals and adjust their policies. So probably in the next few months, you'll see SSS actually trying to comply with the new normal in as far as the requirements for documents that can be submitted online.
Okay, next question. For the transportation of the employee to the hospital, is it required? Sorry, for the transportation of the employee to the hospital when worker is a suspected COVID-19 patient, is it required to have someone join the worker? Or is the protocol no one should join the worker during the transport to the hospital? It is a
That's
concern
one
here
of
in
the
the
reasons.
company. Okay, sir.
That's one of the reasons why you want to link up with DOH so they can provide uh, their full force of medical support for them, including the people who will transport them. Is it required for companies to join in the? No, you don't want to do that. It's not required. That's why you need to refer them to those people, the health network, healthcare workers uh, who are more have a grasp of how to do it and what to do during such a situation. So you are not required, but you have to monitor because they're your employees. You're not obligated to, but out of certain moral responsibility to your workers, you should monitor.
Next question. What if the employee is tested positive? Is it the employer who will shoulder hospital expenses? Is the provision of shuttle services to employees mandatory even in GCQ area?
Yes to the transportation, because as it's part of your obligation, it's specifically provided that if you want to operate your business, IATF is always saying that if you want to operate your business, then provide the shuttle because there's no transportation. And the transportation, even if there are, it will still be risky for your workers. So you don't want that. You don't want your employees to take the public transport and bring the virus inside your company. So yes, several guidelines require companies, if you want to operate business, you'll have to uh, provide for transportation. The other point on, what is it? The other
The
point, Ms. Marcia?
expense, if the employee is tested positive, will
The
the
expense,
employer,
yes.
uh,
The expense actually, that's the reason why we are contributing to PhilHealth, why we are contributing to ECC. Because supposedly that contribution covers up for our share for whatever sicknesses the employee will have. Of course, it's not actually fully our obligation. So if the worker got infected by COVID-19 in the workplace, then that becomes work related. Then they can apply for ECC. But COVID-19 infection may be due to transportation to and from the company that's still part of the ECC. But for some other reasons, it may not be work related. So the government has the systems. For example, you have the PhilHealth. If you have the HMO, then those are our contributions to such. More than that, we are not obligated, but we are encouraged to share because it's very expensive for a worker to get infected by COVID-19. I've heard it's 1 million to even recover from the sickness.
okay. Next question. Are we required to hire safety officer given that we are only a small group, less than 10 employees?
Yes, safety officers are required regardless of the number of your employees, and if you are whether you are minimum or medium risk or low risk company, every employer, every company is required to have a safety officer. The number of which depends on the risk assessment of the company. And it can be just assigning. It can be one of your employees to be assigned as safety officer, not to hire a new one. But that employee to be assigned as safety officer has to undergo the training for safety officers.
Okay, we still have two more questions. Can we still extend for 2 minutes? Okay. Sige,
They
2 minutes,
cannot
last two
answer, so
questions.
I'm okay.
Yeah. Okay, so for the next question, we are already submitting WARE, that's WAIR, the quarterly
Mm.
report to DOLE. Are the cases to be reported on the monthly WARE submission being required on this guideline related to COVID-19 cases only?
No, it's for both. If you have that's the purpose of the daily health symptoms checklist. That should be for monitoring, particularly just for COVID-19 related purposes. The WARE covers both accident, illness related things that will happen in the company. So it does not have really just to be relating to COVID-19 or just relating to other illnesses other than COVID-19. So it's a combination of both.
Okay, for the last question, if we want to restrating a company, is there anything we need to be aware? Restarting, maybe this is restarting. If we want to restart a company, is there anything we need to be aware of?
You'll have to assess. You'll have to assess for the top management to assess several things. One is systems in the company, how it can be more compliant. You'll have to assess your finances. You'll have to assess if the company can continue operating. You'll have to assess your people. Uh, how many people are comorbid with comorbidities, are senior, how many are sick, where are they living. So there you have a lot to assess before you can actually just start operations. You have to check if your company is compliant with the new regulations, or even just one, even just a matter of ensuring physical distancing in the company. You might have just this workspace, and if you comply with the physical distancing, then it might not be enough. You don't have enough workspace. So you'll have to start with assessing your company even before you start operation.
Okay. We still have one more question, but we are running out of time. So again, for those questions that were not raised at this moment, we will just be sending email response to your questions or queries. Okay, so it looks like we have covered all of our participants' question except for one. Thank you again, Mr. Guerrero, for the presentation
Thank
and
you. Thank you.
answering our
Thank you everyone for
audience's
listening.
query. So before we wrap up our program, we would like to call on Ms. Kazue Shimizu to share to you some insights about our company and services and also do the closing remarks. Please take over, Ms. Kazue.
Thank you, Ms. Masha. Good afternoon, everyone. My name is Kazue Shimizu. I'm Assistant Manager of HR Department of iCube Inc. Thank you very much, everyone, for attending our webinar today. I hope you could learn a lot about DTI-DOLE guidelines, as well as other regulations in the Philippines in order to restart operation at your company. At the end of the webinar, I'd like to briefly explain about our iCube Group HR services, especially related to COVID-19. We have been working as HR consultant for quite a long time. We usually support our client to establish company rules and regulations, making contract and some other documents, establishing a system for performance appraisal or salary structure, and so on. But under this current situation of COVID-19, we know that most of our clients are struggling with restarting operations or business continuity. Therefore, we would like to support our clients, especially in the services listed in the slide. For example, we can offer you an advisory on business continuity, particularly on areas such as reduction of manpower or closure of company. We also have services to establish OSH policy for the new normal. We have some other services as well, so please feel free to consult us anytime. And lastly, okay, here are our contact details. For any inquiries about today's seminar, or if you need any assistance from us, please email icube.japandesk@link.asia. For any Japanese client, please contact shimizu@link.asia. Okay. Again, thank you very much and arigatou gozaimasu for attending our today's webinar.
Thank you, Ms. Kazue, for the closing remarks. Again, for all our participants, thank you for the time that you shared with us today. We appreciate you being here. Feel free to contact us on the numbers and email addresses flashed on the screen should you need any consulting or help. We will be glad to assist you. So thanks again for joining us today, and we will see you next time. Thank you, everyone.